Total knee replacement, or total knee arthroplasty, is a surgical solution for severe knee joint damage. It involves replacing damaged surfaces with metal and plastic prostheses, aiming to relieve pain and enhance mobility. Common reasons include osteoarthritis and severe injuries. Recovery includes rehabilitation for strength and flexibility. Consulting an orthopedic surgeon is crucial to assess if this procedure is the right choice for restoring your quality of life. Total knee replacement, also known as total knee arthroplasty, is a surgical procedure designed to alleviate pain and restore function in a severely damaged knee joint. Here's a breakdown of key information. What is total knee replacement? It involves replacing the damaged surfaces of the knee joint with artificial components, prostheses. These prostheses are typically made of metal and plastic. The procedure aims to relieve pain, improve mobility, and enhance quality of life. Reasons for total knee replacement. Osteoarthritis. This is the most common reason where the cartilage in the knee joint wears down. Rheumatoid arthritis, an autoimmune disease that causes inflammation in the joints. Severe knee injury, fractures or other trauma that damage the knee joint. Other less common conditions. The procedure. The surgeon removes the damaged cartilage and bone from the ends of the femur, thigh bone, and tibia, shin bone. The artificial joint components are then cemented or press-fit onto the prepared bone surfaces. The patella, kneecap, may also be resurfaced. Recovery. Recovery involves a period of rehabilitation, including physical therapy. The goal is to regain strength, flexibility, and range of motion in the knee. Full recovery can take several months. Important considerations. Total knee replacement is a major surgical procedure. It's typically considered when conservative treatments, such as medication and physical therapy, have failed to provide adequate relief. There are potential risks and complications associated with any surgery, so it's essential to discuss these with your surgeon. Where to find more information? Reliable sources of information include the American Academy of Orthopedic Surgeons, AOS, the Cleveland Clinic, Johns Hopkins Medicine. It's important to consult with an orthopedic surgeon to determine if total knee replacement is the right option for you.